think there are still some people streaming in, so maybe we'll give a few more minutes and we can start a bit later. And also just checking if all the panelists are here before I begin. All right, awesome. Maybe we'll start at 4:05 because I think there's still quite a number of people streaming in. All right, I think we can start now. So I'll just start with some administrative items before we start the seminar proper. Hello, and thank you everyone for coming on time for this seminar. I'm glad we have such a large turnout today. Really shows that there's such a keen interest in today's topic. Today's webinar actually has the highest number of signups we've ever had for a webinar or seminar in the history of SSR. So it's nice to have you all here with us today. Yeah, it's also a nice way to kind of round off the webinars we've had planned for the first half of 2021. As usual, we'll be having a break in June for the month of June, but resuming our seminars after that. So do look out for our communications on either our website, on EDM, or our Facebook page. So with that being said, welcome. I'm Fiona Yong, a research executive at SSR. And whether you're joining us on Zoom or streaming this on Facebook or catching this at a later date as a recording, we'd like to thank you for taking your time to sit with us for our webinar today. Yeah, some of you may know already that SSR holds monthly seminars, which now have been converted to online webinars, where we hope to provide a platform for researchers and practitioners in the social service sector to share their ideas, research, and findings with the larger community. And we hope that providing this platform will spark some interesting discussions and perhaps even further collaboration opportunities. So today's webinar, titled Mind the Gap, Learnings from and Suggestions for Coordinated Community Support, will be a panel-style discussion with some of the Mind the Gap collective members and moderated by Dr. Ng Kok Ho, who is a senior research fellow and head of the case study unit at Lee Kuan Yew School of Public Policy. So I will allow them to introduce themselves further later on. But in line with hoping to spark some interesting discussions today, we'll be taking questions via Pigeonhole. I will send the link in the chat later, but it's pigeonhole.at/SSR-MTG. Yeah, so you can go there and submit your questions and also vote on your favorite questions because those will appear higher on our list by a number of votes. Yeah, so lastly, this session is being recorded and will be streamed and stored on our Facebook page. So after this session closes, it will be available there. And you can also find all of our previous webinars recorded there as well. So I think that is all from me. I will pass my time to Dr. Ng Kok Ho.
Thank you, Cleona. Good afternoon, everyone. Welcome to this afternoon's seminar on Mind the Gap, Learnings from and Suggestions for Coordinated Community Support. Um, we have with us this afternoon a very large and very exciting panel. I'll just introduce them very quickly. Later on, I'll ask them to do a round of self-introductions. We have with us Ranganayaki Sangavelu, Deputy Executive Director of Beyond Social Services, Anthea Ong, former NMP and Chairperson of A Good Space, Vincent Ng, General Manager at A Good Space, Abhishek Bajaj, co-founder of The Sixth Sense, Lim Jingzhou, community worker at the Cassia Resettlement Team, Ho Siu Cheong, Chief Executive of Reach Community Services. And our panel will have been larger still, but unfortunately, Elizabeth Quack, Program Manager of AWARE, wasn't able to join us due to some urgent personal matters. But nonetheless, a huge and very exciting panel. And just a few quick announcements to reiterate a few of the things that Cleona said. Please do send in your questions throughout the session using Pigeonhole. So the URL is pigeonhole.at/SSRMTG, right? SSR Mind the Gap. So please send in your questions there. That's what we'll be monitoring to do our Q&A session, not the Zoom chat and also not the Facebook comments page, right? So do use Pigeonhole. And this afternoon, we'll be talking a lot about some of the lessons learned from the Mind the Gap initiative. And the full documentation of that effort is in fact in a report that SSR has released. You'll be able to find this report at SSR's website if you look under publications, but the host will also be sharing the URL for that report, both in the Zoom chat as well as on the Facebook comments. So please do go there after the session to read the full report. And as Cleona mentioned, we are quite fully subscribed on Zoom. So if you have friends who are trying to get in but can't, do direct them to Facebook, right? Just go to Facebook, search for Social Service Research Center. You'll find the event streaming live over there, right? So that's our announcement. In terms of proceedings this afternoon, we're going to start with a little poll in a minute, and then I'll ask the panel to introduce themselves. Right. After that, we will hear from Jingzhou and Ranga, who will take us through an outline of what the MTG is and what it did. Right. And after that, it will be an open discussion. Okay. So to kick things off, I believe that Cleona is going to launch a poll now that I invite everyone to participate in. Yeah, there you go. So the poll question, should NGOs and social work agencies provide financial assistance schemes as an alternative to public assistance? So I'll give everyone half a minute to do this. Okay, I think it has settled into a pattern, which is an overwhelming yes. Right? So yes to whether NGOs and social work agencies should provide financial assistance schemes as an alternative to public assistance. This is one of the issues that we'll be talking about a lot for the rest of this afternoon's session. So now, can I invite the panel members to do a quick self-introduction of who you are and what your organization does? I'll just call on people, right? Because we're on in different sequences on Zoom. So can I please first invite Anthea to introduce herself?
Thank you very much, Kok Ho. Hi, everyone. My name is Anthea. I am here wearing the hat of the chairperson of A Good Space. So at A Good Space, we are Singapore's first cooperative for change makers. So yeah, looking forward to the session today.
Thank you, Anthea. Ranga?
Hi, Ranga from Beyond Social Services. We work with 1 and 2 room flat families living in 1 and 2 room flat rental housing estates. And we are in 64 blocks across Singapore. Yeah, I think that's about it. We'll share more later.
Thanks, Ranga. Vincent?
Yeah, hi, good afternoon, everyone. My name is Vincent, and like Anthea, I'm from A Good Space. To build on what she said, essentially what we want to do at A Good Space is to kind of gather diverse change makers to collaborate on social change projects together. And one example of this is the MTG Collective, which kind of our chairperson, Anthea, has initiated. Actually, interestingly, prior to MTG, we had not worked directly with members of vulnerable communities, nor had any experience with financial aid disbursement. But interestingly, because of these diverse members and networks that we had, ourselves and CRT were able to collaborate with 12 organizations outside of MTG who sent us some potential applicants. Yeah, so that's our self-introduction. Thank you.
Thank you very much, Vincent. Abi?
Thank you, Dr. Kokko. My name is Abhishek. Very nice to be here. I'm a co-founder of Sixth Sense. Sixth Sense is a volunteer ground-up that operates at Kebun Baru. We conduct children-based sessions on Saturday evenings with them for the past 2 years. For last year, we realized there was an extensive need for financial disbursement. So it was one of the unique cases when, as a ground-up with a very specific role, we kind of diverged towards financial aid assistance. And I hope to share the findings today. Thank you.
Thanks, Abi. Jing Zhou?
Hello everyone, good afternoon. I'm Jing Zhou from Cassia Resettlement Team, or CRT in short. My team serves the low-income community at Cassia Crescent. Most of the residents we work with stay at a specific block, in fact, so very focused work. But most of these residents are also relocated from other rental flat communities, some prominently known like Dakota Crescent, some less well-known like Sims Drive. Our scope of the work responds to the residents' needs, so we don't have like a particular area of work per se, and we are all volunteers at CRT. Similar to what Vincent shared, I think because we have a very specific community that we are working with, we also were very intentional in ensuring that we work closely with a lot of different community partners so that the MTG support can also be extended to other communities. Thank you.
Thanks, Jing Zhou. Xiu Chong?
Hi, good afternoon, everyone. I'm Su Chong, the Chief Executive for Reach Community Services. Reach operates 4 services: family service, youth service, counseling service, and senior service at different locations in Singapore. So our kind of range of clientele is quite broad. It's a pleasure to be on this forum.
Thank you, Xiu Chong. So that's our panel. So next up, onward with the program, I'll now invite Jing Zhou and then Ranga to share with us what is MTG, how it started, and the work it has done.
Right, so now I'm going to share on behalf of the collective a quick introduction to what MTG is, in case some of us might not have had a chance to read the full report yet, although we very much encourage you to do that. So getting started. The history of MTG really, I think, is that at the start, before we even sort of, really form, we were engaging with media outlets, specifically Straits Times, to connect them with the various community members or clients or residents we work with. And I think a big intention of this was to empower people so that they have their own voice and platform, so that people, the public, can understand the impacts of COVID-19, not just on themselves, but also on low-income households. This was only possible, of course, with the extensive groundwork that was already being done by different agencies on the ground. And so what that resulted in was an article on the Straits Times that was published on 19 April. It was a long feature with a few families featured, and also sort of the sharing by different agencies serving a wide range of communities. The result of that was an outpouring of support by the public who hoped to contribute financially in these times of needs. And so that was how the seeds of this collective came about. The initial members came about, and we reached an agreement to establish a collective fund, because we wanted to ensure that the sort of contributions, the public donations, weren't only going to the families featured in the article, but all the other families who were also struggling with the effects of COVID-19. And I think one of the key things that also struck me was that you would see that we've commenced fundraising and we reached an agreement just by the next day on 20th April. So it was really fast. And this pace of things getting done, I think, was only possible because of the existing relationship and trust between the agencies. In total, MTG raised around $1.1 million from 585 donors, and again, strikingly very quickly within a week. All agencies then agreed on a collective legal agreement within a month. So this was by around May 2020, and this was finalized then as the contract so that we had accountability and good governance in place as well. There were various clauses to tackle design, to tackle data sharing concerns. It outlined the application process and more. And then applications opened officially on 19 May, and disbursement began close to 2 weeks later in early June 2020. And the final disbursement will be for the month of June this year, June 2021. And in total, MTG served a total of 767 households through 8 collective members and 19 collaborating agencies. The structure of MTG is really sort of a collective, a coalition of social service agencies, non-profits, and ground-up community groups. Some of the social service agencies run government-funded services, some don't. Most of the ground-up community groups are powered by volunteers, and they do work on a range of issues and communities. The collective met regularly. We met almost on a monthly basis, and this was our platform to share updates with each other, discuss issues that have emerged, fine-tune our processes, and also as a collective decision-making mechanism. Decision-making was made on an equal partnership basis, meaning that every agency had a board and all decisions were made through consensus. The main principles of MTG, really, there were 3 of them. The first is we wanted fast access and easy access, meaning that we didn't want it to be too onerously difficult for families to apply for financial assistance from MTG. We also prioritize support for some households, so you would see the 3 sort of branches there, mainly those who had difficulties accessing existing schemes, those who might be receiving assistance currently but were receiving inadequate assistance, or people who require urgent financial assistance, usually while they're waiting for their other applications or appeals to be processed. So that's the second pillar. And the third pillar is we also really wanted to ensure that we extend the reach of support to people who are in need due to this pandemic. So we asked ourselves, who are the people, which are the communities that might have been excluded because of the design of certain policies or schemes or systems. And that also sort of really motivated the effort to work with a wide range of collaborating agencies so that we could share the MTG resources with as many people as possible. The eligibility criteria, there were 3 that was set in stone. That's the first 3. Basically, the family should be affected by COVID-19 financially. Most of them reside in a rental flat, and there should be someone in the household who is a Singapore citizen or PR, SC or PR. But we also appreciated that to really be able to provide assistance sort of promptly, quickly, and also to ease the access, we needed to empower various, whether it's social workers, community workers, or volunteers from each of the agencies to make the necessary assessments and exercise the flexibility required. So with that came a list of exceptions that we approved at the onset of the fund, meaning that even if the families did not meet the first 3 eligibility criteria, as long as they were covered in a list of exceptions that we have already approved, the agency could approve the application directly without needing to go through an appeal process within the collective. So some examples of these are exceptions that were pre-approved. For instance, families who might live in a purchase flat, or families who might not have a Singapore citizen or PR within the family. And of course, even after all these sort of measures to ensure that we could be as flexible as possible, there might still be a few cases that still do not fit all the criteria or the exceptions. And that is when we had an appeal process where members of MTG will assist to review these appeals, usually 2 other agencies to look into the appeal. For the application and disbursement, there were mainly 2 types of fund disbursements under MTG. One was emergency fund assistance, and this was disbursed on average between 1 to 5 days, but on some cases when possible, a same-day disbursement was done. And there was also monthly assistance as the other type of disbursement. This was usually processed and dispersed every 2 weekly basis, so every fortnightly. And different agencies might collect different information according to what they already know, according to the various processes that the agencies have in place. But the official requirement for MTG applications only require the main applicant's copy of NRIC. This was to ensure that the audit requirements of ensuring that the funds were dispersed to a person, a real person, can be established. We also needed an official document like a bank statement that allowed for the verification of bank account details for fund disbursement. So this doesn't mean that the applicants needed to submit the transactions that happened, within the last 3 months, or even show the amount of savings they have left. We just needed some official document that could verify that the person that the application says the money will go to is the same bank account of the receiver. So this was the audit requirements in place. And other than that, we also needed to know the number of household members and the main applicant's contact details. What does the assistance actually entail? Each agency had the discretion to decide how much and for how long, but typically each approved assistance was between 100 to 500 per month and between 1 to 6 months. The amount and duration might differ for exceptional cases. So some cases might have more than 6 months but lower quantum, or some might even have higher quantum but for shorter duration. But all of these do not need to go through the appeal process as long as the total assistance quantum does not exceed the cap of 3,000. MTG assistance is also provided on a household level, so it's provided per household, but in special situations where we needed to approve applications for 2 members of the same households, it will be reviewed through the appeal process. So some of these examples include a household member that might have the same registered address but might be living apart, or for instance, family who have some family issues, marital conflict, but both parties still require assistance. And then on top of all of this, there's still one-off emergency assistance that's not included in the $3,000 cap. And that's all on the sort of brief introduction on MTG. And I'll hand over to Ranga now to share a bit more.
Thanks, Jingshu. We'll do a quiz on this later so we know whether all of you know the criteria very well. As Jingshu was speaking, I think you saw the detail that had to go into this collaborative effort. So it's safe to say that this was the first time all the agencies and groups here were part of a self-established multi-agency active response team. It felt like we were working in civil defense for a while when we first started, because we're really very actively listening to our communities that we each engaged and bringing that back to the table so that we could shape the fund well. And this placed a lot of responsibility on each participating agency and group. We had to operate based on mutual trust, openness, sharing, and cooperation. So it was like, if you look at our WhatsApp chat that I was just looking back on this morning, is 1 whole year of sharing different links that we saw, different things that we learned from the communities, so many things, right? Yet we represent 8 agencies and community-led groups. And all the communities that we engage, there are overlaps, but they're also quite distinctly different. So why did we come together? As Jingshu shared, it was a spread in the Sunday Times that represented many members that we served, that kind of all put together in this broadsheet, and that brought us together. But that was not the only reason. I think among the agencies that some of us who had collaborated earlier, there was a common sense, a common purpose. So the common purpose was to reach those affected by COVID-19, and the support had to get out to them immediately. So that was a common purpose. And when the immense civil society support came along, we kind of shaped a conduit to channel the resources. So we saw ourselves more as a channel to directing the resources that came from civil society to the people who needed it. And of course, we had to set up a fundraising platform, and we did that. So I just wanted to emphasize at this point that we have been represented as a fundraising collaboration for fundraising. It is not really collaboration for fundraising. The funds were needed to support, but it's a collaborative effort, is to learn from each other and support various communities across Singapore. And as we did that, I think the key thing that I got, and we have shared before, is we linked up, we were able to reach far, and we could dig deep into the various communities that we were in. We reached people across Singapore. And thanks to Abhishek, even people in Singapore, but living in Pulau Ubin. So, beyond social services may not have the reach to pull out WIN, but through a partner, we did that. And through the rich sharing, as I said, at every meeting on the WhatsApp group, we learned more about each other. We were also able to direct each other to the right resources. So some of us were distributing resources that were like food or digital devices that all came up as a result of COVID. And then we shared, we reached out to the communities through that. And through this collaboration, we reached out to the other partners in our daily work. So each of us don't work in a silo. We also work with other partners. And through us, the partners that we were engaging were also able to channel the resources to their own community members. While it all sounds very perfect and, we were not like holding hands every day, we didn't always agree. So there were occasions where we would disagree on something and then we'll come together to talk about it. But I think groundbreaking ideas come from disagreements, and that led us to shape and reshape as we were doing this project. And just for that, even today on the panel, we may not always say the same things. So be prepared for that. We will disagree with each other. We'll have different points of view. So I just wanted to say that we are not a homogeneous group. We came together as a collective for this collaborative effort. We will have differing views. And we also know that this is not the end of the Mind the Gap. We will collaborate on different things beyond this. And I think we will continue to have disagreements, agreements, and we will just continue to grow. So I just wanted us to share, I wanted to share the flavor of the group. Thank you so much. So now we'll let Kok Ho take on the mic.
Thanks, Ranga, for that, and Jing Zhou as well for a very clear introduction to the MTG's work. I'll kick off this discussion with a few questions, but I was looking at Pigeonhole, and already some of the questions that have streamed in are the ones that I was hoping we could discuss. The first one was, we hear there are 8+ agencies involved in MTG. And then you mentioned it's quite a substantial amount of money, right? More than $1 million. So in this very resource-scarce social service landscape, I'm sure there are members of the audience thinking, hey, how come I didn't know? I also want, right? So why were these particular agencies invited to be part of MTG? Were there others that were also interested? How did you decide? Maybe I could ask Anthea to comment.
Sure, Kok Ho. Yeah, well, no real magic formula. Actually, I remember that, when I found out the public was contacting Straits Times to donate to the families whose stories were featured in the Straits Times article that Jing Zhou and Ranga alluded to, we thought this would be a great opportunity, right, for us at A Good Space to organize a ground-up collective emergency response. However, the intention was for it to be an emergency response. Kok Ho, it didn't, because how would we know we're going to get $1 million, right? When we first came together, we were working already with this different agencies. So I remember reaching out to the agencies that were featured in the article, whom we know, we have worked with, we know at a personal level. So obviously, the likes of Ranga and Abhishek and Jing Zhou, right? And even from Aware and Readable. But at the same time, we were very clear when the initial group came together, we're very clear that with the donations that were going to come in, we were going to actually invite every single agency who was featured in the article. So in total, in the article, which I must say was a very comprehensive report, thanks to the two wonderful reporters, there were 14 agencies who worked with these families that were featured in the story. So we actually invited all the 14 agencies, and then the 8 that you now know decided to be part of that shared agreement that Jing Zhou very clearly shared earlier. And so I think, so the basis was always coming from, we wanted to take this opportunity to also organize amongst agencies, particularly with ground-up groups, which is not often the way of collaboration in the social service space. It was also an opportunity to perhaps, given the crisis, challenge the current model of social assistance and financial assistance by actually involving the ground-ups and even social enterprises and bring different agencies together. I think where we came into surprise was that we started with 50,000 as a target to raise funds for the work that Ranga was talking about. Really, it was for emergency response. When we actually managed to raise, $1 million, that then actually evolved it from an emergency response effort to being able to give monthly assistance over a period of time. And in this case, was 6 months, right? And I'm so happy that, we got to obviously know more about REACH, especially whom we didn't know as well before this collective. And of course, Methodist Welfare Services, whom we also didn't know. But I think going back to what Ranga and Ching Zhou said, it was really starting with existing relationships, and that's why we could pull the initial group together to kick off the collective. And we call it Mind the Gap because all of us work at different capacity with these families in vulnerable and low-income communities. So we are aware of the gaps, right? And I think this was an opportunity for us to challenge the status quo and try to expand the current model of our social security approach.
Thanks a lot, Anthea. You mentioned challenging the status quo, and of course the title of the coalition, Mind the Gap. Really the keyword in that title is gap, right? So that is also currently our most popular question in the pigeonhole, but I'll just hold that for the moment, right? To create anticipation. I wanted to go back to something that was mentioned in Jingzhou and Ranga's presentation, that the MTG effort was created to address kind of the hardships created by COVID-19. We've also seen many accounts since last year that people who were already faring poorly before COVID, they suffered the most during the pandemic, right? So I wanted to ask this. How did MTG manage this difficulty of differentiating between old hardships and new hardships, right? Because of course, it's not just the MTG, but many policy kind of government schemes, right, and policies are very careful to say that they're only targeting people who are suffering due to COVID-19. So creating a situation whereby people who are doing poorly in the long term did not really benefit from the schemes that came up last year. So how did MTG manage this? Did you go about wanting to differentiate between COVID and non-COVID related hardships? If you did, how did you manage it? Were there any struggles? Anyone can jump in.
Yes, hi, thank you. So for 6 Cents, we reached out to 3 transition shelters and families at Pulau Ubin itself. And when we reached out to them, we realized that they had a whole host of existing challenges and difficulties, which were made worse due to COVID-19. So many of them found job loss very destabilizing to their financial plans to make debt repayment or care for the ongoing care for the family members, medical care for the family members. So we actually witnessed that there was a convolution of these challenges coming together, which made the situation even more dire for the families. So we saw it as holistically as possible to actually appreciate where the family is coming from in this moment, and also speak to the social workers who have known them for a longer time to see, if the aid comes in, how long will it take for them to, how long will it benefit them, and how long will it take for them to improve their situation itself? Thanks.
Anyone else?
Maybe I'll just make a comment here. Su Chong from Reach Community Services. We have taken an approach to first start off with people we know. So Reach has got we kind of broadly reach out to seniors, to youth, to families, and so on. So these are the people we've known to us, right? Most of them. And in the best of times, these are really people who are struggling. And when COVID hit them, because these people do not have much reserves, so it shows quite quickly that they're in trouble. And because we were in contact with them, so we kind of follow their development through the pandemic. And and that's where we in reaching out to them to help them to get onto government sponsored systems. Yes, we do that. But we also realize that many of them have got needs beyond what the government is able to cover at that point in time. So it was really so-called a godsend for many of them, really, because they were already in bad shape, and then COVID made it worse. So that's how we kind of reach out to them.
I see. So it's not really about two groups, those who are affected by COVID, those who are already doing poorly, because often there was an overlap between these two, right? Existing.
But I'd like to say that, so at Beyond, we actually did focus on those affected by COVID. So in some sense, the prerequisite was job loss or loss in income. Majority of the people that we engaged were a direct impact of COVID. Given that we are already working in the low income community, what Siu Chong has shared and Abhishek has shared is an ongoing hardship for the families. But we focus on job loss and loss of income as the key criteria for the fund.
Okay. Just so for Ranga, did you make any exceptions? What if were any kind of existing clients who did not fit into those two categories, right? Job loss, income loss, but who were just doing very poorly? Were they allowed to tap into these funds?
We of course have to be compassionate. And here I'm missing my colleagues a lot because they were the ones who were doing the interviews on the phone. And we had a lot of people calling up to disburse this fund. And there were exceptions. There were exceptions when, let's say there was illness in the family. You couldn't go to work for 5 days because, you had to go and take that MC for 5 days, even though you had a little sniffle. So there is loss of income somewhat. And then when it came to children studying from home, the home-based learning, they needed more food because the kids are always at home. So, in instances like that, we did extend support. But I must say that most of the families were impacted. So there wasn't a case of someone being totally untouched by COVID when it came to their income.
I see. So you mentioned about being compassionate, right? Which was something I wanted to ask the panel about. You flagged also how one of the most distinctive aspects of the MTG's work is its flexible approach, right? The flexibility with which you assess cases, listen to the groups you are working with, rather than to impose some kind of unbending criteria. In fact, I thought it was interesting that Jingzhou said at the outset you already decided on exceptions. So you made rules and then you already decided that you were going to break them sometimes, right? So this is also one of the questions on Pigeonhole. With this flexible approach, flexible meaning across different individuals, but also diverse approaches across agencies, how did you maintain this flexibility without compromising on good governance and donor accountability?
So I know we will get this question on these exceptions being decided on the onset when you have rules. It doesn't seem intuitively normal, right? But actually the discussion that we were having on old hardships and new hardships was precisely a mirror of this exception example, right? So the eligibility criteria for MTG as a whole was that you should be financially affected by COVID-19 somehow. Of course, for example, Beyond might have specified that it was more to do with job loss and loss of income. Some other member agencies might have a broader definition of affected by COVID-19, financially affected by COVID-19. But even then, there was an exception that we written in that was pre-approved that said that even though they might not, be explicitly or can justify how they are affected by new hardships, as long as they are in current hardship and as long as it's related, I think, to old hardships, we all saw it as a need to be met. This was a household or family, a human being that was struggling, that had challenges. And I think we couldn't just turn an eye away just because it was not sort of starting from when COVID started, for instance, right? So that's the first thing. And I think the second thing on this sort of tension, right, between flexibility and governance and accountability. I think one thing that I like to share from CRT's perspective and experience is that just because there is ease of access, just because there's flexibility, doesn't mean that anything goes. Doesn't mean that as long as you come forward and say, I need this money, and then you will be given this money. I think while we had diverse approaches, we all had different approaches that we had used, that we had made sense of, and that we had designed based on, I think, the communities that we knew, based on the approach of our work. right? And for us at CASIA, I think what was easier for us, and I think we discussed this in some detail in other platforms as well, that all these years of work that we had in the community was preparing us for the challenges that we had during this period, right? We couldn't make as frequent home visits because of the COVID restrictions. We wanted to align with the spirit of it. And we wanted to disperse help for people who need it as soon as possible, as conveniently as possible. So what that previous work we have done on the ground helped us to do is that we already knew a lot of these residents and families well, right? We already engaged and interacted with them for a long time. We don't need to have a new interview with them to understand what their family circumstances were, what their previous employment was, and what was their financial situation. We also didn't need to doubt whether this is a scam or fraud because we would have known, right, some of these residents, some of these families, they were already struggling financially before COVID-19. And based on, the sector of the job, how things would turn out. So a lot of these things we were enabled, I think, by the past work that we have done, and also by a very community-based approach, community work, and the importance of it. So even though we were flexible, it doesn't mean that we weren't also, I think, doing what was necessary to ensure that help reached the people who really needed it.
We can maybe spend a little bit more time talking about this because it already gets into one of the top voted questions on Pigeonhole, right? And at some point, we're going to have to talk about this, which is SSOs and Comcare, right? Of course. So I imagine, on the same issue of consistency in application of rules and so on, of course, we tend to think of consistency as one of the hallmarks of good governance and accountability, right? I don't know whether if as individual citizens or as social workers, if we hear that, say, the SSO in Bedok uses a different set of rules from the SSO in Yishun, but then we'll think, oh, very good, it's because they know their community, or we'll think, hey, no, wait a moment. There should be one set of rules that's applied uniformly to all citizens, right? So this is, of course, not an easy question, right? We think discretion is good sometimes, but we also intuitively believe in consistency. So does anyone else have anything to add about this? Should we be applying one set of rules to everybody, or should we be informed by our community knowledge and be prepared to tailor the way we work? Any other thoughts on this?
Yes, this is a very good question on consistency and the idea of reliability. I think the fact that as a collaborative effort, when we all came together, I think the way that we build credibility with the public system is when we are consistent as well, right? So that people know that whatever stories they're hearing from us, it's has good governance, etc. So consistency is extremely important. But at the same time, we have to realize that COVID-19 was quite extraordinary circumstances. So there's not it was not like a usual circumstance. So maybe for me, I feel like consistency could be applied to, like a status quo situation. But when it comes to COVID-19 circumstances, when situations were being thrown at us by different family circumstances, we feel like, some personalization was needed. As an example, when we gave assistance with for 6 cents, we actually had families who were Singaporeans but were living in, say, Johor Bahru. But then because of the border restrictions, they were, say, not able to go back and had arrears building up through rent, etc., and higher cost of living in Singapore. So these were not normal circumstances for, a normal family household, but we needed to look into, why are they applying for help? And the fact that, it's because of the COVID-19 restrictions that this situation has come up. So I just felt like, from my side, some personalization is very important. Thanks.
Yeah. So I don't think MTG was set up to duplicate what the government is already doing. They have already got a system well thought through, well engineered, and so on. But because it's a national system, so there are certain rigidity that has to be built in, right? But MTG is meant to help, particularly those who kind of fall through the crack, where the government system, even if it's available, may not be adequate, or maybe they don't even qualify. So in that sense, the so-called the the needs of the individuals are kind of being thought through and discussed. I think, and that's where some of the seemingly exceptions have been made for that purpose.
I also wanted to add about this flexibility bit, right? I think there were two things was a concern to me personally. One was the accountability to donors, and the other is governance of donor funds. That whatever the donors have donated to, that is what we are using the funds for. So and all the agencies understood that. So that's why the processes that we put in place, that everyone was able to follow. Given those two, the flexibility operated within that that agreed governance and donor being accountable to our donors. So I think it's about looking at the difference between governing government funds versus community funds. So this came from civil society. We are answerable to civil society that has donated the funds. And civil society has placed their confidence in these agencies, which is us, that has the reach to the community. So in that sense, as long as we stick within some predetermined clauses, we can decide based on the needs. And that is the difference. The ideal way that a community can become stronger is if such funds exist as mutual support funds. That means from within the community, people are managing a fund that is meant for mutual support among themselves. You know, that would be my ideal version of an MTG. But here, of course, the funds are being directed through established agencies or registered charities. So we took the added caution. And I would say that this is the best way actually to be able to be more flexible. One thing that strikes me, even when we do financial assistance in other situations, right? There are certain bars that are set. If you are only eligible for rental housing if your family income is below $1,500. It has become almost like carved in stone, right? We wonder, hey, who came up with this 1,500? Actually, we cannot find it. It is there. It is there on the websites. It is stated there. But I think along the way, some of these markers have not been shifted. And in that sense, yes, maybe flexibility has got to be better understood or implemented to also move some of these markers in the overall financial disbursement. But that's another conversation altogether.
So,
Anthea, just add a few words there. I think when you mention consistency, Gaho, I think that's true. We do need to have consistency, but what are we actually practicing consistency on? Are we looking at consistency in terms of the markers and the rules and the processes, or why can't we be consistent in our approach and intent? Right? So if the consistency, and I think that's important because we are talking about social assistance and social security for the most vulnerable members of our society, then it's then for us to consider, do we then change the conversation from consistency in terms of fixed markers like a predetermined income, or are we looking at consistency in terms of the intent and approach, which means that it could be compassion, it could be flexibility because there's a crisis, and therefore that same set of rules really would not apply but we are still consistent in our intent and our approach in supporting this communities, right? So yeah, I would challenge that actually we should be consistent, but it's what we choose to be consistent in. That I think it's an important question for us all to ask. I would argue it should be consistency in intent and approach lah.
Thank you very much. So now we're making a distinction, right? In fact, between kind of just a procedural consistency, meaning applying the same benchmarks and so on. Because of course you could do the wrong things consistently, right? So consistency is never self-apparently a good thing. So you are saying, let's also look at our intent, the way we go about the work, and that has to be consistent. And Ranga also mentioned there are governance principles. A contract was drawn out for the way the money was looked after. So it's not an either or. There are many points along the spectrum of how we govern funds and so on. It's not that you either check things to death, right, regardless of costs, or you give away money anyhow, right? So this actually addresses the most popular question on Pigeonhole at the moment. How can we do financial assistance in a way that is dignifying, but that also guards against fraud? But that most popular question on Pigeonhole is actually two questions. It also asks what were the specific, very loudly, specific policy gaps present in the various government schemes, right? Here, I will draw the audience's attention to, when you have the chance, the report where they mention that in a way, I think the MTG designed their work to patch certain of the very well documented gaps and difficulties with the formal social assistance system. And the report flagged at least three of these challenges in formal social assistance. One is access. Access including eligibility, but not just eligibility. Sometimes people qualify, but you need to do a lot, right? The forms. So access and eligibility being the first. The second challenge or gap is adequacy. Even if you qualify, you may not get enough, right? Either enough in amount or enough in duration. And then the third is timeliness, right? Of course, you may qualify and get enough, but you may not get it when you most need it, right? So this is an unavoidable question, right? Which is that if the MTG's approach of doing financial assistance, right, which is you want to make access unhindered, make sure the help you give is adequate and timely. If this is the right way to do it, then are we doing ComCare wrong, right? So if MTG got it right, that means have we been getting ComCare wrong the whole time, right? Any thoughts?
This is almost a who dare speaks kind of a silence.
Yeah, I know, right? And then both of us are unmuting at the same time. Ranga, okay, you go, because I was actually going to say that, you know, I probably am not the best person to even judge whether ComCare, you know, is right or wrong, because I compared to, I think, the likes of Ranga and Jing Zhou and Xiu Chong, we are not built at a good space to be actually administering or even supporting our you know, members on that, right? Where ComCare is concerned. But I think where I was coming from, Gaho, was to actually maybe ask for the question to be reframed, right? In the sense that I don't think we necessarily think that we are right in what we have done in MTG, right? And neither am I saying that, therefore, if we are right, and given that the approach is markedly different from ComCare's, then ComCare's is wrong. I think what I saw in what we have learned from this MTG initiative for the last year is how there is so much more room and space for us to go beyond what we have now in our security, so social security or social assistance model, right? And if anything, you know, at least I speak for myself, I hope that this MTG project or experiment, if you will, because we really did set it out as an experiment, we didn't know how far we would go, would allow us to have a conversation now with some data and some tangible example in the form of what we have done in MTG, to then bravely and boldly start to expand beyond what ComCare scheme is, right? Whether it's in terms of the process, whether it's in terms of the quantum, but also in terms of, you know, the intent and the approach. And I think that for me is where this project, you know, has hopefully offered you know, some value in sort of reframing and changing the conversation within the social services sector, particularly in social assistance conversations that we can have. And that's where I would come from. I can't really comment on the specifics of ComCare and what is right or wrong, but I'll leave that to Ranga.
Neither can I, actually, because we are not established as a agency that actually refers that many people to ComCare. We do know of community members who tap on it. I think this should also be made into a poll question, Gokko, for the organizers to put it up to the listeners here, you know, to participants here, because I don't, like Anthea said, I don't think either or. A fund like this that we set up has got its limitations. we could only support people up to 3 to 6 months. Whereas I've heard of many members who applied for ComCare and still get funding up to a year or more, depending on their situations. So ComCare does provide longer term support. There are various complaints about ComCare, maybe waiting time, eligibility, there are many such concerns that are raised, which I think still probably needs to be looked into. But along the way, I also heard of ease of application. Recently, when the recent measures, there were families that received some support, emergency support through ComCare administered by CCs within a few days. So like within 2 to 3 days, they already had support because they had lost their jobs and they needed immediate support. So ComCare is a thorny subject. And I would say it's not either or. What we were doing was supplementing, bridging the gap, as we said, as people waited for ComCare. So really, I think it is something that we shouldn't do away with. Neither should we say that is sufficient or that's the end all.
Could I just chime in on this, Koko?
Please.
I thought what was interesting, I agree with Ranga's perspective that it isn't really a kind of binary thing. I think in our experience, when our volunteers did the financial assessment, the means of providing financial assistance was a good way for us to also perform community outreach. And eventually, for those of the folks that we did kind of get in touch with and who did apply for the MTG, the volunteers also used that as a way to steer them into conversations to be reconnected back to formal systems, whether is it ComCare or the other kind of areas of kind of social assistance. So I don't think for us it was a binary thing. Yeah, I think sorry.
Thanks. I think Jing Zhou had a comment and then Abi.
Yeah, I mean, I think the question asked for specific gaps, so we still need to, I think, discuss some of the specificities. So I'm going to give a shot at this, but I also need to look at some stats, so you have to give me a bit of time to run through this. Koho talked about timeliness, right? And I think one of the issues that we really saw as a specific gap was two prongs to this timeliness issue. The first being that the reason why a lot of these applicants and people needed assistance urgently was that they had very little buffer, very little existing resources that could buy them some time until the ComCare is approved, until the SSR appeal is approved, right? And the evidence, don't just take it from me, and I thank Antia for asking this question in Parliament. And this was data from MSF in 2018, when they actually shared that the average amount of cash savings for households who are receiving ComCare short-term to medium-term assistance, it's only $246 per household member, right? And you imagine in Singapore, a little bit of buffer, build up a bit of savings, but this is all these low-income families, and who are receiving ComCare, this is the amount of savings that they have. And the social work practitioners around us will know very well that part of the reason why this is the case is also because once your savings exceed a certain level, even though you are low income, you're not going to be provided with any financial assistance from the government. In a sense, having some savings, trying to build up some savings for rainy day actually means that you might get disqualified from different subsidies or assistance scheme. So that's one reason, the lack of a buffer, lack of savings. And then of course, I think to take into context is not just the specific policies or agencies. I mean, we already knew that 4 to 6 weeks for ComCare or even longer for SSR meant that that was already difficult. But with the additional context of COVID-19, some of the waiting time was even longer. We heard of stories of SSOs, NTUC, different administrators being overwhelmed. And this was not just the conventional financial assistance sources. I think those that are less well-known or less applied for. I think there was an applicant who shared, I think there was this fund that they were setting up for, where you could attend a course, they would provide you with some support, some stipend as you attend the course. And an applicant was sharing with me that this agency that was administering this, they were overwhelmed. Their accounts, their finance department couldn't give out the disbursements of these stipends in time because they were entirely not prepared for something like that, right? So that's an example of timeliness. So we look at it from the prongs of lack of savings, application waiting time, the context of COVID-19. But like the example that Ranga mentioned of interim assistance, again, you look at, if you examine, I think the statistics closely enough, there is interim assistance under ComCare, which is meant to be provided speedily, right? One question I have is that as I examine the statistics, you kind of see broken down into the different parties who provide ComCare interim assistance, right? You have the CCs, like Ranga mentioned, the FSCs, the Family Service Centers also do it, SSOs do it too, and there's a Community Justice Center, but that's a very small number. So if we look at the numbers between the CC's interim assistance, the FSC's interim assistance, and the SSO's interim assistance, what I am shocked by is that the source that provides the most interim assistance is at the CCC, at the grassroots level, which is kind of counterintuitive for me because most of the financial applications for ComCare actually flow through SSO, but they actually have the least among the CCs, the FSCs, and the SSOs in providing interim assistance. So it's something sort of amiss there. I think that's a question that we should look at. And then into access, I think some of the specific gaps, we've heard many stories on how the documentation required was very onerous, very rigorous. And a lot of the people who had struggles with it were especially self-employed persons, right? Self-employed persons that never saw the need to retain documents of their income source and all of that. And this time around, it was great. I think I was also surprised to see that there's substantial support given out to self-employed persons. But for them, without all this documentation, it was an uphill task. Some had to appeal 2 or 3 times to even get their SSRs approved. So there was that gap on documentation, which then MTG responded by saying, okay, we'll be a bit more flexible, we are less demanding in terms of the documents required. So I think those are some of the gaps that we saw, but I think we also want to acknowledge some of the good things that the existing system provides for, right? I think like what Ranga also mentioned, I had to tell applicants myself that to say it's not going to be possible to rely on MTG. One reason is that it's not going to be long-term as you can get from say the government assistance scheme. And the second thing is that we could only provide, max quantum of 3,000 per household for usual cases. And some of these households applying had total household members of 8, 9, or 10. And that was clearly inadequate. But I said, if you apply to SSO, they can consider the number of people staying in house and they could provide more help, right? So there's the issue of quantum, duration. We also see the good things that come with getting ComCare if you get your foot into the door, right? It comes with healthcare assistance as well. Your healthcare bills are covered, public health institutions. Families with children find it easier to access MOE FAS if they need. And during the circuit breaker period last year, I think they also implemented some changes to allow for auto renewal of assistance. I think it was for a delimited period of time, sadly, which did not continue. But I think some of these gaps and some of these good things that we also saw.
Abi, if you could comment on this briefly, then we'll move on to the next question.
Sure, thank you. And thank you, Xingzhi, for the analysis. I think for Sixth Sense, we're very careful in our messaging. For instance, when you were speaking to social workers out there, we're very careful to always tell them to rely on the longer term assistance that's available through ComCare and the different schemes that were made available last year, and not just rely on the MTG fund, which was more of a top-up fund. That's how we saw it. Secondly, we felt like there was great space for innovation as well. For example, many of the schemes were now administered online, so people did not have to just go to the community clubs to do so. So that spoke to a different brand of how do you actually apply for social assistance schemes? So you can just apply it online, and many of times it's auto renewal. But of course, many families actually struggle with SingPass and having access to financial documents and paper slip, which shows that there's been a drop in income. So definitely there's some sort of face-to-face facilitation was necessary as well. Thanks.
Thanks, Abi. Picking up on one of the last things Xingzhou said, which is that some of the assistance schemes, formal assistance schemes, they tailed off and then ended, right, after a while. But of course, we are not out of the woods as far as COVID is concerned, and who knows how long this will be for, right? So there is a question I think to be asked here, and one of Xingzhou's comments about the limitations of the MTG's work is not that it was doing its work wrongly, but that it had limited resources, right? That's a practical constraint, but it's not a deficiency with the way it went about its work. So I guess the question is there room for something like the MTG even after we revert to normal times, right? If there is such a thing from now on even, right? Normal times, right? So now it's beginning to blur, right? When we still need emergency assistance, when we don't, when we lock down, when we open up. Is there space for something like the MTG in the long run? So if resources were not a constraint, would it be a good thing?
No, I like this question a lot, so I'll just go with it. And here, sorry about that. So I think I like this question a lot because it comes from the point of active citizenry. And of course, citizen juries is a very big thing in our government right now. So different ways of citizens participating in the government processes, etc. So there's some motive here that people want the citizens to be informed and partake in processes, etc. And, it's really about citizens going out and saying, okay, these are the needs of my community. I can do ground sensing. I can find out, how I can actually use my skills and actually contribute to our society as well. So it's really the different kind of volunteering, that I could see it as. And if we have more MTG style, but not just financial aid, but it could just be, for instance, data cards, or it could just be, some sort of like healthcare based, any programs and initiatives. That could also be one way of collaborating as well. Because citizens can come together and say maybe basic needs are a little bit more than just food or housing. Maybe basic needs are defined as nutritional food, or access to quick medical care or awareness. So if collectives come together and say, okay, this is a standard that I want to work towards, collectives can work towards it as well. So I'm just trying to say that it expands the scope. It creates a lot of citizen consciousness, which is actually quite good for our Singaporean society.
Anthea?
Yeah, thanks, Kaho. I was going to say that, as long as there are gaps, in the system, then mind the gap still, would be a good way to sort of, mend the gap, right? And so to your question about whether if there were no constraint in terms of resources, would something like a mind the gap type of approach, should we have that even in peacetime, right? I wouldn't want to say normal time because, to be honest, I'm not sure that we can go back to what it was before COVID. So I think that's one part of it. If there are still gaps, then therefore this approach should continue, right, at some level, because the gaps have not been mended. The other way to do it is that it may not continue as a ground up effort, right? Maybe it could be something that could be integrated or in some ways infused within the official system, right? The public system, and so that we don't need for a mind the gap type of a collective, which will always be limited in resources because there's always a term, to it. So taking the points that we have learned from the Mind the Gap initiative and seeing where within our current official system, the public assistance system, could actually, be sort of integrated with. I think that would be a good way for us to move forward for our low-income families. Because as what Ting Zhou said, and I remember that question very well, if they are being penalized when they have savings, and they actually then don't qualify for the social assistance, then those are some of the things that we can actually look at, right? That brings in some of the approaches that we have used and practiced during the Mind the Gap collective.
I'll just go very briefly.
Was it Vincent who wanted to go? Or Jing Zhou first, huh? Jing Zhou, then Vincent.
I'll just go very briefly. I think what we should definitely retain and take away from this is the collaboration that we have learned in MTG, right? And not just collaboration between SSAs, but also between community grown-up groups and all the interactions that we have there. So there's definitely space for that. We should definitely keep that and keep it going. For financial assistance, MTG as financial assistance, I think I'm a bit more skeptical about that. Of course, immediate direct needs and suffering exists, and I think if we have the resources, it will always be good to continue. But I think it's not to do so with just purely providing financial assistance. I think that advocacy here is then very important because I do not believe, or rather I choose to hope that there is hope for the system and the policies to adjust and change to address some of these issues and challenges that these people have faced, have shared about, and what we're talking about here today. And so then the answer is not, just MTG keep plugging the gaps and taking what's solving the problems that are left behind by the system. And those are just solutions at the financial assistance level system. But one step deeper, which I think we should also have a conversation about, is that financial assistance is not going to be the solution for poverty, right? We had many conversations, I think, since the GE season on minimum wage, low wage work. I think this entire pandemic season has also cast an eye on essential workers, protection for self-employed persons. All these are conversations that we need to have. And we shouldn't, have it at the expense of just providing financial assistance as the final solution.
Thank you, Vincent.
Yeah, thank you, Koko. I just want to expand quickly on what Abhishek shared earlier. And I think just to share our own learning as well, I feel like our own experience here has really highlighted the need for maybe ground-up movements to be enfolded as an important piece of our social service, social sector ecosystem. Very often, these folks who are in the community, very deeply rooted, like Jing Zhou, Abhishek, and so many of us here on this call, have these last-mile connections with members of different communities. And I think in a pandemic, when ground needs evolve very quickly, these deeply entrenched relationships really help. I think for us, we observe that because as Anthea mentioned, as an organization, without any kind of prior connection or any direct work with so-called members of different vulnerable communities, we were entirely reliant on these 19 other organizations, different ground-up groups, different community groups to kind of source the applicants with us. I wanted to share a very quick story that was a bit funny as well. So some of our members eventually, they in the attempt to try to outreach to potential applicants, they decided to do some community work at a particular locale. And they chose this location because one of them had actually liked the cats in this location, and he kept on coming back over years, and it helped him with his mental health condition. What was interesting was when circuit breaker hit, he and his group of members together, we went to speak to some of the formal agencies in that area. And they mentioned to us that they didn't have the capability, they didn't have the capacity to outreach to new clients. They were just kind of overwhelmed with the new caseload. And they were basically just being able to paste posters at high traffic areas in their neighborhood. When we asked how we could help, they were not comfortable with sharing their client details, and so we left it as that. But what was interesting for me was to observe the kind of ingenuity of these volunteers who are not bounded by certain rules and what solution they came up with. So this gentleman who had been going to this community, he happened to be a food delivery rider. So when he received kind of orders from the neighborhood, he would come on bring the orders along, but he also brings some very basic needs assessment forms that we kind of designed, and he gave it to some of the youths, and they kind of distributed it. And eventually that form allowed us to kind of get to know 60, I think it was 60 families in that particular locale. Yeah, so I think just speaking from a spirit perspective, to echo what Abhishek said, I think this spirit of active citizenry, whether it is MTG or not, should continue. Thank you.
I wanted to add on to what Jing Zhou shared about advocacy. So as we were doing this disbursements and engaging the families, we also did the research. And one of the key things that stood out for us is that actually the low-wage workers have little protection. And a large majority of the families we work with, they work in the gig economy, and there's little insurance or support for them in terms of injuries or sick days and so on. And the minimum wage is the other thing, right? So I think we are building up our knowledge, deeper knowledge of the communities we work in. And you cannot, in that sense, not have a MTG type of support, because I don't think the systems are strong enough to support the low-income communities at the moment. So MTG is something that not in that same shape and form, but ground-up initiatives through different collaborations are crucial. The other thing I wanted to mention is today marks 60 years of the first Bukit Ho Swee fire. 1961 was apparently when the first set of houses in Bukit Ho Swee got razed to the ground because of the fire. We are born out of that fire, not in 61 because it was a series of fires. We were formed in 1969 as then a social project. And I think what our roots are in community engagement and participation and community development that comes from people who had not very much. Together, they had more. So I think this is our roots, and I think we will always foster partnerships with different stakeholders in the community and involve community in this change process. What better than somebody who's caught in that situation to be able to highlight to you, this is exactly my situation. Because if you look at ComCare, they can't release such data. We, amongst our own communities, know such information and know such data. And then we become an invaluable support to existing government support that is out there.
Thank you. Winding down, I want to ask you to maybe reflect on the idea of community work, right, and community workers. And I know in our audience today there must be many social workers who, as a profession, spend much of their energy across all sorts of agencies, from SSOs to hospitals, working on administering financial assistance. Right? So social workers are trained and they spend a lot of energy developing the expertise in assessing people for financial assistance, in implementing financial assistance. But here we have, through the example of the MTG, a group of organizations, including what you call ground up groups, ground up movements, and NGOs, which are not necessarily run by social workers, who seem to be able to do this with no difficulty at all. Right. So how do we think about, so for the purpose of for the audience, right? How do we think about the role and place of social work expertise, right, in our social assistance landscape in Singapore? Do we really still need social workers? This pause is even longer than the one for the ComCare question, which is a bit surprising. Yeah.
I'll attempt a brief answer, okay?
Okay.
We are all fighting different fights.
Mm.
We are not out here to kill each other. I think social workers do have an oversight of the cases that they handle. And I think I saw somewhere the number of cases that social workers handle is always too high. So they do have intimate knowledge of the families that they're working with. So we all have different fights. And a community development supports the social work. And perhaps social work can learn from the community development principles, because while we stick, while I say we, because I am a social worker as well, while we stick within the confines of the program or the disbursement that I'm required to do, the casework that I'm required to do, now we are also opening up to look at how does community engagement, community participation enhance that casework that we do. So I think that's very, very important. We all have different fights, and it's not either or.
Different roles and responsibilities,
yes,
right?
Yes.
As I think the report also flagged how by focusing on this financial assistance work, MTG frees up social workers to focus on high needs cases that needed a lot of support last year.
Yeah.
Any other thoughts on this? Yeah, Ranga.
No, I just wanted to say we collaborated with different FSCs in the neighborhoods we are in to be able to also engage their members in disbursing the funds. So it was always collaboration even with the FSCs. Yeah.
Understood. I think so. You wanted to say something?
Yeah, and I mean, when there were social workers that were involved as case workers or otherwise working with these families and people, I think we made an intentional effort also to not need to make a separate assessment. If the social workers were happy to talk to us, happy to share with consent given, of course, I think we were very happy to take reference from their recommendations and assessment, because why put the family through the need, through another round of interview if that was the case. So I think there's still definitely a role there for social workers, although I would say that when it comes to assessment of financial assistance, I think by and large for most cases, we might not see the need for fully trained professional social workers to do basic means testing and income and expenditure assessment, to check through income documents and collect documents and things like that, right? I think many of the social workers or social service practitioners I know have so much on their plate, high caseload, and there are so many needs to be dealt to. And we even know that in SSOs, for instance, I don't believe that all the SSO officers are trained social workers for that matter. So we do see that there is maybe no complete need for social workers to entirely be responsible for financial assessments. And if we could free them from doing that, could they better be able to serve different families and communities with the professional skills and experience that they have?
Thank you.
Yeah,
Abhishek, and then Anthea, and then
I
Xiu
think
Chong. Okay.
I think the question really here is like, how do different services in the ecosystem collaborate and integrate with one another in the future? Given that we went through COVID-19, given that now that we are faced to heightened measures, it actually speaks to the need of community wanting to engage the ground, wanting to engage the communities. But how do we do it? And what does this model look like? I think that's the overarching question that I'm thinking about at the moment. And my thoughts are that, back in 1996, when we had the many helping hands approach, of course, people spoke about it to a very great extent, but is it still something that we can still practice in this moment? Or is it something that needs to be modified and relooked at, for instance? And what will the future of that look like? Whenever we present to, say, transition shelters or different agencies about Mind the Gap Fund initially last year, everybody was very thankful for the community, community to come forward and offer assistance to their residents. So actually, there's actually a lot of happiness in collaboration, from what I understand. Thanks.
Not bad. We only mentioned many helping hands at 5:22. Okay. I think Xiu Chong had comments, and then Anthea. Okay.
Yeah. Okay, so I'd like to just briefly comment about the role of social workers. When Reach entered this collective, I mentioned earlier on that we have got 4 services, one of which is our family service. So internally, we form a team. Most of them are not social workers, but one among the group is a social worker. So in a sense, she brings into the group the knowledge, also the consistency of, if it is a government dispensed fund, then how would we have handled it, and what's the benchmark, what are the processes, and so on. So I believe maybe Methodist Welfare Services, or even beyond, also have such capability that you do not need everyone to be a social worker, but you may need some, right? So that few people kind of provide the scaffold, and then the rest of us can operate within that. So along with that, I just want to make another comment concerning how I feel about MTG. I think the one big word I want to use is collaboration. I mean, among us, I think some of us are bigger agencies, some are smaller agencies, but there's this spirit of wanting to work together. Now, for that, I must really thank Beyond Social Services. We leverage on them to provide the backbone of the things we in terms of fund disbursements and so on, and that enabled all of us to participate in this. And beyond the 8 of us, there are also another 19 other bodies that we collaborated with. So this is very reflective of what a community should look like. That some of us have the skill, but others can kind of band together and leverage of each other's skill, and then the output can be a lot more. If everything going to depend on social workers, I don't think they have enough hours in a day to finish their work. Right? So that's I think that there's a role, but not everyone needs to be a social worker.
Thanks, Xiu Chong. Anthea?
Thanks, Kak Ho. Thank you, Xiu Chong. I'm actually that's a great segue to what I was gonna share. Yeah, I mean, I think I'm with everyone here. I don't think it's a either or again, right? Clearly, there is a role for social workers. And in some ways, I mean, the fact that we call them social workers, they are working for the communities that they've been trained for. But I think as what many of us have said, where the collaborative spirit is concerned, is how do we then design community groups, right? And ground ups, informal groups into the system of social assistance, of social support, of social security. And I think then with the community groups and the ground ups particularly, but even social enterprises, they work with the community because there's so much on the ground, right? They don't work for, they work with. I think this combination really then helps us to optimize on very limited resources that we are faced with when trying to, work with this low income community. So I think definitely I am very for us designing the community agencies, ground-ups, informal groups, social enterprises, that's sort of part of the larger ecosystem, but design it into the system of social assistance and social support. And that, as everyone has said, that helps to free up the social workers who can continue to work for the members of these communities. Yeah.
Thanks, Anthea. The clock is running down. So to wrap up, I'm going to ask each of the panelists to just very briefly share with us their thoughts on the future, on the possibility of something like an MTG2, for instance, or what they have taken away from MTG1, right? What do you see in the future? What have you learned from doing this work? What are your hopes, right? Any of those questions along these lines, briefly from each panelist. Can I ask Abi to start?
Yeah, thank you, Dr. Koko. And I think it's a good question because currently, Sixth Sense with a good space and Majority Trust, we have all come together to actually distribute data cards to the communities. At this moment, so we've distributed about 155 data cards to 7 agencies. And, it is so amazing that, we were able to come together and very quickly, rally the resources to make this happen. It's all because of the relationships we built last year, the understanding and faith we have with each other, and the muscles we built on community grounding, community sensing of the needs. So definitely MTG2 or not, I think the idea of collaborative work, the idea of coming together to work with one another will go on for a long time. Thank you.
Thank you. Vincent?
Thank you, Koko. I second Abhishek's point on this idea of what possibilities can we create together as a collective that we cannot create alone. I think I personally am very excited to continue on this journey to exploring that. A quick kind of learning point for me, being completely new to financial assistance disbursement, is really this idea of dignity that kept coming up. I was quite surprised, honestly, to learn about how some of these assessments are being made, having been completely new. The idea of what are basic needs has been sitting with me since. I remember there was one kind of applicant where we approved his request to pay off some arrears from an electronic bicycle that he bought. And that has sat with me since. What is a basic need? Yeah. Thank you.
Thanks, Vincent. Xiu Chong?
I think if all the 8 agencies in this collective individually attend to the needs for COVID affected community, I think for this same period of time we will have achieved a lot less, right? It's because we could work together and we kind of energize each other, right? And if we work alone, we would probably be limited by our own abilities. Okay, I can only raise that much money. I would just do that much. But in this instance, the money was already there, and what we did best was really to focus on where the needs are and able to dispense this cash to the needy people. And I think we achieved a lot more working that way. So I do hope that we would have some form of MTG down the road. Maybe organized a little bit differently, yes, but I think the spirit of collaboration should continue.
Thank you very much. Ranga?
I really want to thank all my colleagues at Beyond and a bunch of volunteers we enrolled, because the work that it entailed every fortnightly was a lot. So I think we would not have been able to do this if not for the fact that 2 volunteers stepped up and almost worked full-time for us to weed through the applications and ensure that there are no duplicates, because we cover, sometimes our geographical boundaries overlapped. So for MTG2 to be there, it must be there, is that you need a whole village to be able to take care of the various needs. And many of my colleagues, I mean, it's almost like Beyond already had somewhat of a mechanism going, because we receive funds to support with COVID-19 family assistance, and we kind of just adopted MTG and shared our processes with the rest of the agencies, and we ended up being able to disperse quite quickly. Within a month of forming, we were already dispersing. So I actually wanted to say that social issues don't exist in isolation. There's always these overlaps. And given that that is the nature of the families that we work with, collaboration is inevitable. So whether it's in the shape of an MTG, in the shape of other collaborative, other kind of collaborative, products that come out of this, it is highly crucial. And we must always look towards then not just ending the project and then saying, okay, it's done. But in this collaborative effort, what new things did we learn? How can we do this community engagement and development better? How can we project the voices of our community to others so that policies will shift? Because otherwise then we are just containing the work as our work, which is not the case, right? Our work exists because of community issues, and then we have to keep projecting this out to everyone. So even in today's gathering, 200 over people, close to 300 are listening to this, and actually I think that is a collective change.
Thanks, Ranga. Anthea?
Thanks, Kak Ho. I would also like to take this opportunity to thank the two reporters who put this article together that actually inspired this whole year of collaboration between the agencies, and that's Tijor and Janice Tai. And of course, every single one of our partners here on this collective. For me, I think it's been just truly humbling and gratifying, right? To see how when all of us could come together, no matter how different we were, and as Shu Chong also alluded to, some of us are much larger agencies than others. We actually practice equal say, right? And Jing Zhou mentioned that we all had a vote, right? And so this is very much a cooperative structure, right? Where it doesn't matter how big you are, how much money you have, how many people you have, you still have one vote. And I think that for me is the sort of my hope, my dream in how we work in the community, to build a better Singapore, to build a better society, particularly in the work that we do with members of our vulnerable communities, that it's a participatory type of an approach. And it's, there's equality, it's fair, and it's just and dignified. I think what I took away was just like Vincent, I really didn't realize how onerous and at some level how undignified some of the processes that our families and individuals from low-income communities have to go through in the assistance process. And so that was eye-opening, and was not lost on me that we may all be in the same storm, but we are not actually in the same boat. And so I really hope that what we have done with MTG would allow us to have a conversation like the one that we have today, and many more to come, in sort of working out how quickly and willing that we are to update and improve our social security system and the community development work and engagement to support our most vulnerable. Because I think this will measure who we are as a society and prepare us well for the next storm. But never do it alone. I mean, it's just not possible. So let's build this together.
Thanks, Anthea. And finally, Jing Zhou.
Thanks. Yeah, I think I'll focus on my personal takeaways, my lessons from doing MTG. I remember some time back, I was engaged in a very heated debate with someone on the issues of adequacy and timeliness of financial assistance. I didn't feel that I responded very well in that debate. I was focused on the specific case we were talking about, and I couldn't quite draw on the larger issues that I think we should be talking about. But with MTG, having read through and talked to so many people, looked at all these cases of financial issues and assessment. I mean, we dealt with some of this for a long time, but I think the volume of this was really different. What I think made me really think about was, well, there's a first question of what happens if MTG doesn't exist today? What if we didn't have this fund, and what if we weren't able to provide this assistance? The argument of the person that I had the debate with was that these families would survive too. They would still survive. And I agree, they would survive, because we know many of these families and individuals as very resilient people who have gone through a lot and have and have really overcome a lot in the process. But that does not come without a cost. The kind of problems and issues in our systems, our structures and our policy, they do have costs, and I think we need to pay attention to them. What do I mean? When assistance is not timely enough, I've learned that what people turn to, they'll turn to loans. They go to borrow money from friends, from family, sometimes even licensed money lenders. And that is the greatest nightmare I've experienced, because people come in and say, I have existing financial needs and I have a huge mountain of debts. And the huge mountains of debt comes out of these things like that. These are the invisible costs that we need to pay attention to. Or how about what happens when we do financial assessment and we forget that expenditure is actually reflecting on people's needs, people's means, rather than what the actual needs are, right? So when we look through some of these cases, we go, how is this family only spending this small amount on food as compared to the average that we notice families spend? And then when we ask them, we realize, oh, because we have all this financial commitment, we need to pay for this and that. So we spend less on food. We might eat all this unhealthy food, rely on instant noodles and things like that. And then it got us thinking, these are the invisible costs too, the kind of chronic diseases, long-term health issues that might emerge from it. So I think we want to pay attention to this question of at what cost some of this issue, if not tackled, will continue to cause. And then also importantly, I think just want to shout out at what Vincent was saying on basic needs, right? We really need to have a conversation on what basic needs look like, because we cannot answer the question of adequacy properly without establishing a baseline of what basic needs are and how much financial resources are required to meet those needs. And that is a good segue for me to pass it back to Kok Ho, and a reminder of his team's work on the minimum income studies, the MIS study, on what was the baseline sort of budget required to meet the basic needs. I think they've done it for the elderly population so far, and we look forward to more.
Thanks, Jing Zhou. Also for advertising our research work. I did not put him up to this. I think on behalf of the audience, I want to thank the panel for sharing so much and for speaking so candidly. We all learned a lot. And of course, we know this discussion is in the spirit of learning, and that's why we are prepared to talk about the difficult questions. I also want to thank the audience for participating so actively on Pigeonhole, and there was also a small chat going on Zoom. We weren't able to read out all your questions, but I hope that in the course of our discussion, we did touch on many of the important ones. So thank you all very much. Do not log off yet. I'm going to hand the time back over to Cleona with a few admin matters, but otherwise, everyone have a good break tomorrow, and thank you very much.
Yes, thank you, Kok Ho. And yeah, I just want to echo sentiment. Thank you for all the panelists here today for the rich discussion and for providing your different perspectives from the experiences that you have from the different communities that you serve. And also a big thank you to Dr. Ng Kok Ho for moderating today's session and for posing some really tough questions. I think that made the discussion very interesting. Also, big thank you to all the participants today. So we had a full Zoom session of 300 at one point, and I think there were about 70 to 80 odd people in the Facebook stream. So thank you for those who tuned in. I do have a small little poll for this session, which I will just launch. This is just for our internal reference. So yeah, as you fill that out, maybe I'll just give a small update as well that we will be having a seminar feedback form sometime in June, which is the month we're also taking a break from webinars. So if this is like the first time you're attending our session, or even if you've attended like all our sessions this year, we do want to hear back from you. So do look out for it. And yeah, we hope to perhaps change a few things depending on the feedback and kind of see what people are thinking of our webinar format so far, because we have gone from physical to online versions. Yeah, I think that's about I'll just give a bit more time for people who are voting. But yeah, thank you so much to the NCG Coalition. Right, I think everyone has done it. Thanks everyone for your time today. I think you may log off or stay on if you would like for those who are still here. Same for the MTG members, you don't have to stay. Yeah, feel free to go. But thank you. Goodbye.